So as we know, when we are placing the implants which is surgical driven, we get divergent implant abutment heads, and we need strategy to correct them, okay, and get a good path of insertion for our prosthesis. So this is one of the most important yet ignored thing, where people feel just by milling the abutments we will make the implants parallel. But the moment you try and do only that, then there are a lot of compromises which set in, which we will discuss. So that forms a very important part. The second, I will be giving a live demo of how to correct the angulation in the mouth. Okay. One of the techniques, the video we will soon add up, is correcting with the use of adapters. The live demo we already gave you. Other we are going to give you in the patient. Along with that, the second most or the most ignored part is the jaw relation, centric relation. What I mean by that is, we all know as dentists that the centric relation is the most relaxed posterior superior most positioning of the condyles, where the muscles are relaxed, and it's a repeatable position. Now, because our patients, most of them, they have a skewed bite because they come with certain teeth in the mouth. Some we extract, some have been extracted. Most of them have developed an altered chewing pattern, and we need to get the patient deprogrammed so that we get a correct centric relation. So I will show you methods and a live demo of how to deprogram any patient. And this trick you can use even for your FMRs, crown and bridge work, to do the deprogramming. So you'll get the live demo for that as well, along with how to take a perfect jaw relation. After that is done, come sir, please come. We will be discussing in detail in the prosthetic master class the various type of prosthesis we can make for our patients, which include and are not limited to acrylic prosthesis, which we call as hybrid prosthesis, PMMA prosthesis, ceramic prosthesis, and zirconia prosthesis in various scenarios: when to do, how to do, why to do, and when not to do. Next, we will be discussing another very important part, which is called as the management of recession or shrinkage, tissue shrinkage, by developing techniques of giving temporaries. So we will be discussing how to do various temporaries. 4 or 5 different methods I will tell you about of how you can do temporization in your single piece basal implants with immediate load protocols. Apart from welding, I'm not talking only about welding, apart from welding. Next, we will be discussing how to manage one of the most commonly asked questions, which never been discussed in any of the basal implantology workshop, is food lodgement. And I am not talking about managing food lodgement by packing material over that. I will show you one of the simplest techniques, the TPT technique, which I have developed to manage any kind of tissue dissection, which will help you not only in your basal implants but again your crown and bridge work also. That is one unique technique which I will share with you. It's a very simple technique, and you will be amazed how easily you can manage food lodgement problems. In case you fail to ignore certain basics, then you will land up with food lodgement, and then how to solve it without removing your prosthesis. Okay, I'm not telling you remove and make new one. So that tip I will share with you. And the most important yet ignored thing is occlusion in basal implantology. Now when I say occlusion in basal implantology, I am not going to tell you get 3 points over here, one on the buccal cusp, one. No, I'm not talking. I'm going to tell you exactly step by step how to digitally calibrate the occlusion. And not only calibrate the occlusion, if you have certain devices, you can numerically measure the occlusal forces on your implant and use them to program your patient. So that is the advanced level occlusion masterclass, which I am going to give you, all people sitting over here. All these things which I mentioned, most of it has been never ever shared on any podium on any of my lectures. So you are among the